And Nam says Kano must face justice. He's responsible for the killing of police, military officers, and INEC officials, also responsible in destruction of properties in Lagos. Releasing him will encourage others. Fabian says Ralph Wazirike did not die. MNK must remain where he is. The Biafra agenda is active and is gaining ground because idle Nigerians have been brainwashed. He must pay for the murder of innocent Igbos. Engineer Ismail Ajetola says Nnamdi Kanu can never be remorseful. His Biafra agenda remains top on his agenda. Draco Lugumba says, Babajide, what do you think about the voting pattern of the Northerners going by the last election? Well, that's not the that's not the issue for discussion at the moment. So let me take this last comment and go to our last topic. Well, I think I've taken most important questions here. Comments here rather. So, BKO, a very disturbing one here is the National Association of Nigerian Nurses and Midwives, disclosing that more than 75,000 nurses and midwives relocated abroad in the last 5 years. That's under the Buhari administration. What do you reckon is the cause of this brain drain?
It's very clear. These are skilled workers. In a world where economic migration is constantly happening, skilled workers would always be sought after by the countries of Europe, America, and even Southeast Asia and parts of the Middle East, because in their country, they do not have sufficient manpower to handle these cases. They do not have sufficient manpower for their health services sector. So if they can find them from Africa, honestly, they are going to go for them. And it's not Nigeria. This is not limited to Nigeria. Egypt came up with a law mandating people coming out of medical college to first work in a public health institution for 3 years before they can migrate out of their country. We've seen at least 19,000 Egyptian doctors moving out of their country in just under 5 years. And a lot of them are going to the UAE, some are going to Europe and America. This is a big problem. India and Pakistan still have more doctors practicing in the UK than Nigeria. Nigeria is currently third. And the painful thing is, it is not easy and not cheap to train a health professional. But because of the prevailing conditions in our country, where the pay is extremely poor and discouraging. I went to Adama and I was speaking with a woman with a staff nurse. And she told me, look, a lot of my colleagues have left the shores of Nigeria. Right now, I'm thinking of going. So the problem is, in the past, it was the very senior consultants that were going abroad, for greener pasture. But these days, as soon as these medical professionals, as soon as they come out of medical college, they're already thinking of going. No one wants to even practice in Nigeria again. It is such a big problem. Nurses are affected. In 5 years, 57,000 nurses left Nigeria for greener pasture in just 5 years. Now, in 8 years of President Buhari's administration, 75,000. And it will keep rising unless we fix our health sector, provide the right tools for these medical professionals, these health professionals to work with, pay them living wages, pay them wages that encourage them, pay them allowances, and ensure that we do not even owe them any of those allowances that are due to them. This is the only way that we can keep as many of them as possible in our country, because the 2021 State of the World Midwifery Report put midwife shortage in Nigeria at about 30,000, which is 6 per 10,000 people. So we have 6 midwives to 10,000 people in our country. It is not it's not encouraging at all. Other professionals too, laboratory technologists, they are leaving. It's not doctors alone. It's not nurses alone that are leaving. It's not midwives alone that are leaving. All categories of health workers are leaving. It's a terrible situation that we find ourselves. We are approaching a very dangerous situation where, if we are not careful, if it's not addressed, definitely we will find it difficult to find qualified people to man our hospitals. I was reading about a private hospital here in Lagos, where suddenly they were left with 3 doctors, because within a short time, about 11 of them just japa. It is a disturbing situation. The health sector in Nigeria is in shambles. People leave our country to go and receive Medicare in Cameroon. Cameroon, of all places. Some of our people in Adamawa State, they go to Cameroon to receive Medicare because they don't have quality health institutions, quality hospitals around them. The rural areas do not have enough health institutions. We are supposed to have in every local government, in Nigeria, we are supposed to have at least 2 hospitals. One of them is secondary medical facility, and the other one a primary. What I mean is every ward, not every local government, every ward in our country, we are supposed to have one primary health care center and a secondary health care center. We are supposed, as the population grows, the number of health institutions ought to grow. From having primary health center in every ward or every registration area, every election registration area, we can grow to having one secondary health institution, in each of those wards, so that health services will be brought closer to our people. But that is not the situation that we have. People have to journey long distances for them to receive Medicare. And those doctors, those nurses and midwives are not adequately catered for. Some are owed allowances. They are not insured. Look at how long it took before the government decided to increase hazard allowance for our health professionals and the public health sector. The same hazard allowance that they have been paying them since the 80s, since the 1980s, was what they were paying. And a lot of these people lost their lives during the COVID season. They risked their lives to save the lives of many people. So if we do not improve the state of the health sector, if we do not provide the right working tools, if we do not improve on the welfare of our health professionals, this migration abroad will continue. But I have to agree that 75,000 nurses leaving Nigeria in 8 years, during the 8 years of President Buhari, is really startling. It's a staggering figure. It's something that should bother all of us because it keeps growing. If in 5 years, the first 5 years of Buhari's regime, 57,000 left.
Absolutely.
Then the 3 years that followed, more left to come to the figure of 75,000 that we have. And
it's alarming.
As I've said earlier, other categories, of people also living. Dentists are living in droves. Lab technologists, they are living. So people are living because the economy is just not encouraging.